I too want to add my voice to this on behalf of the three rural independents that are up the Midlands where we are. Look, the problem is historic. We have the 96-bed unit supposed to be there now new. That sort was turned by Minister Harney 20 years ago. So look, the HSE is a failure, has failed badly, Limerick people. And the people of North Tipperary, I want to salute Councillor Shamie Morris, Independent Councillor, on the work he does, and the other people in Nina who resisted the closure of the A&E in Nina, who resisted the closure of the A&E in St John's, and were told this would be the centre of excellence in Limerick. It's chaotic, and people have been left on trolleys. The trolley crisis is unimaginable there, and the stress and trauma on staff and on families and everybody else. We need a whole sea change here. We need a clean out of management, and we need a re-evaluation. We need to reopen St John's and the perfect unit that's in Nina. Now, we have people shouting now, Deputy Kelly made his career out of the closure of Nina. Deputy Lowry supported it at the time, and here we are. The people have been denuded of the services. We don't have mental health bed, and you're the Minister of Mental Health in County Tipperary. We have to go to either Ennis or we have to go to Kilkenny.
I welcome this opportunity to address the House on the issues raised by Deputies O'Donoghue, McNamara and McGrath, and I have to say each and every one of you is not your first time raising this. We hear it on a consistent basis. I wish to acknowledge the distress that overcrowded emergency departments cause to patients, their families and frontline staff working in very challenging conditions in hospitals throughout the country. The health sector is facing significant challenges in providing emergency care over the winter period, while also managing the demands of COVID-19. The emergency department in Limerick is one of the busiest in the country, with over 76,000 attendances in 2021, which was up 16% compared to 2020 and up 7% compared to 2019. However, the number of patients waiting on trolleys for admission in UHL in 2021 were 4.7% lower than 2020 and 35% lower than 2019. But still, that's cold comfort to anyone who is on a trolley. The UL Hospital Group has reported that they are continuing to deal with high volumes of patients attending the UHL emergency department, a pattern that has been sustained over a number of months and has been replicated across the country. UHL are working to ensure that care is prioritised for the sickest patients. As part of their escalation plan, additional ward rounds, accelerated discharges and identification of patients for transfer to UL Model 2 hospitals are all underway. Surge capacity has been opened to manage the extremely high levels of activity. There has been and continues to be substantial investment in UHL and the wider hospital group in recent years to address capacity issues, including a new emergency department that opened in 2017. Since the start of 2020, 98 new beds have opened at UHL. This included the 60-bed modular ward block, which became operational in November 2020 and which was established to provide a rapid build interim solution to begin to address the bed capacity issues at UHL and improve patient flow. This also included a 24 single-room bed block, which functions as a haematology-oncology unit, and a temporary 14-bed single-room block designated for confirmed and suspected COVID-19 patients, initiated in May 2020 under the National Action Plan in response to COVID-19. The Winter Plan 21-22 was published on the 15th of November. It builds on the significant investment in last year's Winter Plan. The Winter Plan for 21-22 aims to address the significant combined challenges faced by the health service over the winter period and recognises that a whole system response is required across primary, community and acute care. The scale of these challenges and the demands that our health system faces require both a plan and an associated system of governance and accountability. This system includes leadership, governance and operations to reflect the scale of the challenges faced and investments provided. The Winter Plan sets out the national area and site-level leadership and governance arrangements that are in place. In relation to the question of a review of UHL, HIQA is closely monitoring the overcrowding situation in a number of hospitals, including at Limerick over the last number of weeks, and has had recent correspondence with the hospital group CEO regarding their evaluation of the current factors influencing crowding in the ED. HIQA have also written to the HSE senior management to highlight HIQA's intention to initiate inspections under the national standards for safer, better healthcare. The matter of performance in hospital emergency departments is under constant review by the department through ongoing engagement with the HSE, and the department will continue to closely monitor the situation. So, Deputy, in relation to the question of a review at UHL, HICWA is closely monitoring the overcrowding situation in a number of hospitals, and there's no further details in the response from Minister Donnelly.
Mattie McGrath.
Mr. Watt and indeed the Minister to go out to Abu Dhabi where we're looking at best practice out there. In this time of COVID, look, that speaks for itself how to touch there. My good friend and your colleague, former colleague, the former Minister, Oireachtas, did her very best to keep Nina A&E open. She was hounded out of office by Deputy Kelly and others who attacked her at the time. We have to go back and revisit and open Nina A&E, a perfect unit. Open St. John's A&E again as an interim solution until we get a new building that's capable of dealing with the number of patients that go in there from North Tip, from Limerick and from Clare and beyond. Because South Tipperary General has an overflow of people coming down now because they can't get into Limerick and are afraid to go with the trolley crisis. So there's lots of things wrong. HICWA investigating is a pure joke. And they're writing to the management now saying they're coming in to investigate. Tell them they're coming in. And they go into nursing home with no prior notice and inspect them and close them down. This charade of the HSE has to be disbanded and open up the perfect A&Es that were there in Nina and St. John's. Thank you.
And obviously I know in relation to HICWA dealing with nursing homes and with CNU's community and nursing units and community hospitals all throughout the country, any dealings I have with them, I just need to say that they are an independent body. The Health Service Capacity Review 2018 was clear on the need for a major investment in additional capacity in both acute hospitals and the community, combined with a wide-scale reform of the manner and the location of where health services are provided. Deputy, in relation to your two questions, will the correspondence be published and is a review being considered? I will follow up with that today and try and get you a substantial answer, because it just says in relation to the question of a review of UHL, HICWA is closely monitoring the overcrowding situation in a number of hospitals, including Limerick, over the last number of weeks, and has had recent correspondence with the hospital group CEO regarding their evaluation of the current factors influencing crowding in the ED. And both deputies, I will bring your concerns to Minister Donnelly. Thank you.
Marcus.